Welcome and happy August. This month we have a lot to share with you, and this is the month of our solar eclipse on August 21st, thus these ridiculous glasses that I'm wearing. But these are an important safety tool that we'll talk about a little bit later so that you can safely enjoy the eclipse. I want to thank everyone who took the time to attend one of our employee forums. We had great attendance this time, and it was a pleasure to be able to speak with a lot of you and share updates about our organization and really just have a conversation. So we'll be doing that again later this year. In the interim, if you have any questions that you didn't get to ask at one of the employee forums, feel free to give me a call. My cell number is 828-508-0096. I'd be happy to talk to you at any time. Really excited as we begin a new month to be talking about a lot of new things happening in our organization. As we've talked about previously, this is a year where we're doing a lot of firsts in the history of our organization, and so we're going to talk about at least one of those here in just a moment, but really want to thank everyone who's working really hard to take care of patients every day, and all of those of you who are participating in these business development opportunities and positioning our hospital to truly make our communities healthier. Thank you. We have opened our new cardiac cath lab. Dr. Nawaz is doing caths on patients now, diagnostic caths on patients, and so this is one of those things where for the first time in the history of our hospital we're able to offer this service, and that's a really, really exciting thing as we are able to impact access to cardiology care for the western counties in North Carolina. And so thank you to all of you who have worked really hard to make this a reality for our patients and our families and our communities. I want to comment on a service that we've offered for a while, but we're really seeing significant growth in this service, and that's the swing bed unit over at Swain Community Hospital. As of today, we have a record number of patients in our facility over there using that service, 12 patients today. This is a service for patients who no longer qualify for an acute care setting, but they're not quite ready to go home, and this provides a transition of care for them that's really important for them and their families. And we have been steadily growing this service throughout 2017 and have really kind of peaked here in the month of August with 12 patients at Swain. So thank you for everyone who has been a part of making that a reality for our patients and their families. It's so much better when they can receive that kind of service close to home, and we get rave reviews from patients and families about the care they are provided at Swain Community Hospital. So thanks for making it happen. Well, I've donned my glasses again to talk about the solar eclipse, which is coming up on August the 21st. We want to give you a few tips to enjoy the eclipse safely. One is to protect your eyes. Get a pair of glasses like this. Be sure to only view the eclipse through this type of protective eyewear, not regular sunglasses. That will not provide you the protection that you need. If you want a pair of these, please contact Sarah Crawford and she'll be happy to get them to you. We need to plan for more people. Some estimates indicate that as many as 60,000 additional people will be coming to our area, and by that I mean Jackson and Swain counties, and maybe into Macon County, to view the eclipse. It is as we are in a prime viewing area for it, so just allow some extra time, be patient. Take extra time to get to and from work because for a few days we're going to have a lot more people in our communities. And also be sure to protect your skin against the harmful rays of the sun. Make sure you use sunscreen and reapply it regularly. It may not feel like it, but those rays that are damaging to our skin will still be coming through during the eclipse. I want everyone to know that our hospitals have worked closely with local resources, various community partners to ensure our ability to provide care for patients that need us during this event. We are expecting an increased number of patients to the region. At a minimum, we're going to see more patients in our emergency departments, and we've made contingency plans around that. But please help us by pitching in where we can, and let's make this a safe and fun event for all of us who are here all the time and those who are visiting us. We've got some new providers joining our medical staff. We have 3 new nurse midwives joining Harris Women's Care. Sally Schaefer, Ronnie Kahn, and Judy Layton will all be joining our women's care practice between August 1st and September 11th as we prepare for the impact of the closing of labor and delivery over at Angel Medical Center. So please welcome them to our community. In addition, Ryan Wade, a new pediatrician, will be joining Harris Pediatrics as we expand that service. Women's and children's as a service line goes together. In both cases, between now and around mid-September or so, we're going to be establishing full-time offices over in Macon County, and Dr. Wade is an important part of the resources we need and the physicians we need to be able to offer that access in Macon County. Then we also have Dr. Jacob Mills, an Emory-trained, fellowship-trained physician in pain management. He has joined us as of mid-July to lead our pain management program as we expand our services, really doing some renovations over at the Swain Hospital to make that a really efficient environment where we can serve more patients. Dr. Mills has hit the ground running, and we're just really happy to have him as a part of our medical staff. So please make sure that if you see any of these new folks, come across them in our hospitals and the hallways, make them feel welcome as they get established here in our community. We talked about this before, but let's make sure that we're always acknowledging patients and families and introducing ourselves as we go into their rooms, as we see them in the hallways, as we try to provide care for them. Mariana Fisher shared with us a really great tip that's a part of this, and I want you to help us take this challenge as an organization. As we're walking down the halls and corridors of our hospitals and our practices, let's make sure we don't have our cell phones out with our heads down. Let's be heads up, attentive on greeting and making patients and their families feel welcome in our facilities. Also, please be mindful of the 5 foundational safety tools that we talk about a lot. They are briefs, debriefs, huddles, learning boards, and executive patient safety rounds. So every week you should have an opportunity to participate in some or all of those tools and see them in action in your departments. So make sure to engage in that as we try to make a safer environment for our patients, their families, and all of us as employees here. Please make sure to stay connected with us on Facebook, Twitter, Instagram, YouTube. Check for frequent updates via the intranet. We want to make sure you're informed about what's happening in our organization. And again, if you missed one of our employee forums, you've got a question for me, don't hesitate to stop me in the hallway, come down to my office and see me, or call me on my cell phone at 828-508-0096. Thanks again for taking the time to listen to this video update. We've got a lot of exciting things happening in our organization, and we appreciate the contribution that each and every individual makes